Welcome to a brand new week of Spicer & Company. I'm Sean Spicer.
And I'm Lindsay Keith. Well, cases of the coronavirus are rising in the U.S., but are we getting the full story?
Yeah, it seems like every day we're told something different and new about COVID-19. And frankly, the message seems a little muddled and confusing. You might read a headline that says something like this: 12 states have set record high in new COVID-19 cases since Friday. That's one statistic that probably isn't good to see. But then you take a look at this chart and you can clearly see the number of deaths related to the virus are on a steady decline. So in contrast, that's a good piece of news. But then you see this scary headline with another dire warning. Another coronavirus lockdown may be on the horizon. Centers for Disease Control warns. But then there's this headline. HHS Secretary Alex Azar visits Massachusetts, says further shutdowns will be locally led. So what's the plan? What's really going on? Let's cut through all the clutter and talk to the man in charge himself, the Secretary of Health and Human Services, Alex Azar. Mr. Secretary, welcome.
Oh, it's great to be with you. Thanks for having me.
All right, so you saw those headlines. I think a lot of people wake up in the morning, they see the news about cases going up, sometimes deaths are going down. What's the real deal with where we are in terms of, are we still in the first wave? Is there another wave coming? And should we focus on the cases versus the deaths?
Well, I don't think it's terribly constructive to talk about waves. We just need to manage the situation that we're facing right now. And here's what we're facing. We now are seeing deaths at the lowest level in about 2 months. And now any death we would like to avoid. But we've now been about 2 weeks with fewer than 1,000 deaths each day. And as I said, lowest in 2 months. Hospitalizations at the lowest level in 2 months. And while we're seeing cases increase, those case increases are happening in about 110 counties across the country, and they can be from any number of reasons, and we're deploying teams out there to get to the bottom of them. But we just had a call with the nation's governors, and what we're hearing from them is that the average age of individuals testing positive is decreasing in many instances, and that's a really good sign. That means we're reaching a lot of people with additional testing, and we may be actually pulling in asymptomatic cases.
So if I was sitting at home right now, what should I look at? Is it the hospitalizations, as you pointed out, the deaths? Because it seems to me as the number of cases, as you point out, is partially increasing just because we're testing more people.
So the single most important thing we've got to do is save lives. And so that's about protecting our most vulnerable. Over 40% of those who have died from COVID are seniors in nursing homes. Basically, the most at-risk people are if you're 80 years of age or older. Under any circumstance, you're very much vulnerable and you need to be protected. If you are 65 and over and you have 3 different comorbidities like hypertension, obesity, renal failure, you're also much more vulnerable. The rest of us have much lower risk of severe complications or fatality. So we really want to protect the most vulnerable, even as we reopen our economy, get back to work, back to school, and back to healthcare.
So, Mr. Secretary, I want to just preface this by saying I have a ton of respect for Dr. Fauci's service and expertise on this issue. He's a very, very brilliant man, and he served this country for a long time. But it seems like he feels the need to weigh in on everything. And last week it was whether or not the NFL should open, and if it does, it should happen in a bubble. The way I look at this, and tell me if I'm wrong, is that you and Dr. Fauci and others give the president medical advice in the rest of our country, and then we can listen to other folks about the measures that are needed to whether open a store or, in this case, the National Football League. But do you think that it's necessary for the government, particularly Dr. Fauci, to weigh in on every single thing?
Well, as you do, I have great respect for Dr. Fauci, and the president seeks input, as you just said, and you know, from many, many different sources. And while Dr. Fauci will bring a virologist, infectious disease perspective to the table, I and others are going to bring a perspective that says, well, that disease prevention and protection are important, but think about all the other impacts on healthcare from being shut down. You know, think about the increase in mental illness that's getting undiagnosed, uncared for. Think about all the childhood vaccines that aren't getting dispensed, all the cancer screenings that aren't happening. Just go through the list of real immediate healthcare impacts from being shut down, and those can quite easily outweigh the impact or the benefit from disease prevention. So the president, the vice president, and I have to take a very broad perspective on all of this.
You know, I want to get to some stuff in the summer in a minute, but let me work backwards. In the fall, schools are considering going back into session, or at least some form. Some are saying they'll go 1 week, not another, or they may continue to do all sorts of online stuff. You and the president, everyone's talking about opening back up the economy. But how can people go back to work if the schools are either partially closed or entirely closed and doing everything online?
Well, we need to get our schools reopened, and there are ways to do it safely. Just as we can get back to work safely, we can get our kids back to school, whether that's pre-K through 12 or if it's higher education. We need to get them back, and we're working with our schools on testing strategies, surveillance strategies. There are basic things you can do, like not have school assemblies, or keep cohorts together in class, or have the kids eat at their desk rather than in a cafeteria. There are basic steps you can take that minimize risk, and then you combine that with periodic screening, surveillance testing to look for outbreaks that you might be facing. We can't have our kids be shut down at home in the same way we can't have our workers be shut down at home forever. We've got to get back out there, and there are ways to do it that are safe.
So there's two issues right now in terms of drugs, right? As I understand, you got the therapeutic drugs that help mitigate some of the side effects, if you will, of this virus, and then there's the actual vaccine. Where do we stand on both of those issues?
Sure. So thanks to President Trump's leadership, as you know, he's very demanding. He wants to see things in Trump time, which means very fast. And so he's initiated Operation Warp Speed, which is this historic effort to say we're going to do whatever it takes to bring therapeutics to the American people and vaccines to the American people in record time. So we've already got therapeutics like remdesivir, which is an antiviral that's out there being used and helping people in hospitals right now. We've got some really interesting good data on the use of steroids to treat people who are suffering lung injury in the hospitals. And we have this stuff called convalescent plasma, which what we do is we take from donors. So if you've had COVID and recovered from COVID, or if you're asymptomatic, you can be a donor. You can literally give life by being a donor of plasma. That plasma then can be taken and given to individuals who are suffering from COVID. It's like an immune system boost for them, and we've got data coming in on that. And so that's on the therapeutic side. And then on the vaccine side, we have several really, really good candidates that are entering advanced stage clinical development. And what we're doing is we're taking the historic step of manufacturing hundreds of millions of doses of that vaccine, even as we work to prove the safety and efficacy, so that if a product's approved, we'll have approved vaccine at the ready.
Yeah. Mr. Secretary, at his rally this weekend, the president addressed the testing results and what he's doing. Let me just play for you a soundbite of what he said.
Testing is a double-edged sword. We've tested now 25 million people. It's probably 20 million people more than anybody else. Here's the bad part. When you do testing to that extent, you're going to find more people. You're going to find more cases. So I said to my people, slow the testing down, please.
Is slowing the testing down really the right thing, or is it, as you said earlier, just saying to people, focus on hospitalizations and deaths?
Well, listen, as you know, President Trump has led the creation of this historic testing system here in the United States, where we lead the world in testing. He was being, I think, tongue-in-cheek there about that, just having fun with the crowd. He's driving us towards ever higher levels of testing, penetration of testing, over 25 million tests done. We did 3.5 million tests just last week. 500,000 a day is our current rate, and that's an important part of our strategy for reopening this country. Surveillance, testing, containment, health system capacity, therapeutics, and vaccine. The six-part strategy that President Trump has built that lets us get our country back to work, back to school, and back to health care.
Mr. Secretary, before we go, I got a really quick question because we're running out of time. If the 4th of July is coming up, and if a big family wanted to get together to have a backyard barbecue, would you tell them that they could or could not, or should not do that?
Well, first off, I'd say always follow the advice of your local and state officials regarding what the state of disease is and their advice in your community, because what's going on in Des Moines may be completely different from what's happening in Phoenix, and you just need to know that and follow their advice first. Second, you got to look at your individual circumstances. Are you or anyone in your family in one of those really higher risk groups in terms of vulnerability for severe disease or fatality, in which case you just got to take extra protection. But then for the rest of us, there are ways we can interact and need to interact with each other as family members. try to social distance, practice good hygiene, and if you have to be really close to each other, if you're going to be crammed in somewhere, you do think about facial covering would be the advice we give. But again, follow local advice. Look at the circumstances in your community and your personal circumstances.
All right. Well, I was just trying to get off the hook for hosting a barbecue. I was looking that you might have given me the excuse, but damn, now I have to go figure out what the local guidance is. Thank you, Mr. Secretary. I appreciate you coming on the show.
Thank you. Great to be with you.
All righty. Well, coming up next, some say the Trump campaign oversold and underdelivered on this weekend's rally in Tulsa. We're going to ask Congressman Lee Zeldin. He was at the rally. And later, Dick Morris is here to weigh in. Plus, Rich Noyes of the Media Research Center is going to tell us why Joe Biden's controversies are being ignored by the mainstream media. You're going to want to see the statistics that we have that show it very, very clearly. Also later, the battle between the administration and John Bolton over the explosive claims in the former National Security Advisor's new book. Stay tuned.